Hi everyone, welcome to 5 Minute Video Study for the NCE. Today we are in clinical focus and we're under subtopic AS. So we are going to be talking about divorce in the counseling paradigm. This is something that, again, society-wise, it is becoming more common. Divorce rates have increased since the mid 20th century. So, divorce is a difficult decision. Um, when a couple decides to marry, many times they feel excited, they feel positive about their future, and they feel positive about kind of the life that they want or envision together. When the relationship breaks down over time, couples begin to wonder if they should continue with the marriage or if it's better to end it. With that, many times there's lots of pain realizing that the marriage is no longer functioning or as envisioned, and there's confusion as well as um, that shock of separation, and a lot of times that can be very debilitating. Talking through your thoughts and feelings is certainly helpful through the counseling or therapeutic process, and that's why therapy can be very beneficial. So, many times, individuals that go through divorce, they can struggle with the decision of staying in the marriage or separating. They may also feel like they want to continue, but then the next day they don't. So that indecisiveness, being concerned about how the divorce will affect children, if children are part of the family unit, wanting to separate but unsure how to express that. So, again, that uncertainty, not knowing how to talk with children, especially young children that may not understand what that separation entails. Also, difficulty communicating with the spouse about the divorce. That's also very common. And then just general anxiety, worry about the future. A lot of times there's separation of assets, separation of finances. That certainly can be a very difficult process. So, with divorce, once the decision has been made, um, it can be a short term relief, but also there's a lot of that. There's a lot of things that go into that. So there can be a new sense of freedom as well as now pressure, financial pressure, stress pressure. Also feeling like kind of a new identity or a change in identity. There's also lots of fears, fear of the future, unknown, and again, kind of the dwindling resources many times, and then kind of the process and the feeling of safety. Many times with divorce, there's kind of a lack of trust, and that can certainly limit or kind of inhibit how that person may view the world now. So that can, certainly change a lot of their perspectives. And that's why, in the clinical field, you may see a lot of anger, a lot of resentment. Um, Many times, the client has to process a lot of those feelings. The process of divorce can be complicated. So, even with situations where there's mutual agreement and collaboration, there's still a lot of pain, and with that, there's kind of that sense of revenge or getting back at that person that hurt them. That emotionality can make it very difficult, and it can also cause a lot of damage. So there's not just the mental health, but there's also kind of the legality of the divorce and how that can be very complicated. with that said, part of the therapeutic clinical process is going through the healing, and not just with the two spouses, but a lot of times with the whole family unit. So understanding how those intertwine, and then finally, if children are involved, the whole notion of co-parenting and understanding how even with the separation, these two individuals still have to work together in order to co parent effectively. So, those are just some issues with the notion of divorce and kind of how that would look like.